First of all, there are 18,822 confirmed aggregate cases of coronavirus in Victoria. That's 113 new cases since yesterday's update. I'm saddened to have to update you that there are now 496 Victorians who've lost their life because of this global pandemic. That's an increase of 12 since yesterday's report. And of course, we send our condolences, our deepest sympathies and our best wishes to each of those 12 families. This will be an especially difficult time for them. They include one male in their 70s, two females and one male in their 80s, 5 females and 3 males in their 90s, and all 12 of those deaths are linked to aged care outbreaks. There are 513 Victorians in hospital. 29 of those are receiving intensive care and 17 of those 29 are on a ventilator. A total of some 2,178,012 test results have been received, which is an increase of 19,863 test results since yesterday. And again, we just make the point how grateful we are and how pleasing it is to see so many Victorians coming forward to get tested. I want to thank each and every one of those almost 20,000 Victorians whose results came through yesterday. And nothing in many respects is more important than us having the most complete picture of where this virus is presenting, how it's presenting, and that's why it's so important that people, as soon as symptoms begin, even very mild symptoms, please come forward and get tested. Visit one of those more than 190 test sites across the state. The turnaround time now is, because of volumes and some other improvements. I'm so grateful to our lab staff across both the public and the private sector. We've got the averages now down to just under 1 day. So some will be a little earlier than that, a little quicker than that, some will be a little longer. But coming forward and getting tested as soon as your symptoms begin, even if they're very mild, staying at home till you get your result, it's a massive and powerful contribution that you can make to our collective fight against this virus. So again, thank you so much to nearly 20,000 people whose results came through yesterday. There are 4,197 cases with an unknown source. That's 46 additional that have been closed out via the coronavirus detective work that goes on each and every day. There are 449 healthcare workers who are active cases. That's an increase of 134, owing to some data cleaning, just some accounting to make sure that we've got the most accurate picture. That includes some disability workers who had not been classified as healthcare workers earlier on, so that accounts for that increase. There are 3,141 active cases of coronavirus in Victoria. Just the usual updates in relation to active cases, the metro regional split, and as I always make the point, these numbers never quite reconcile because there's still some that are being investigated. But we've got regional local government areas under stage 3 are now down to 187 cases. So that's obviously a much better position than we were in just a couple of weeks ago when we had more than 500 active cases across regional Victoria. So I want to thank every regional Victorian for following the rules, for coming forward and getting tested. It's very, very important. The 3 communities, we focused on all of regional Victoria, of course, but the 3 communities where we did think we had a real challenge and where we were calling upon people to come forward and get tested. Greater Geelong, now 65 active cases, just 2 new. Greater Bendigo, 15 active cases, no new cases there. And Ballarat has some 6 active cases and there are no new cases in Ballarat. So that's a testament to the hard work, the amazing work that every single regional Victorian is doing. Those numbers are low and we want to keep them that way, and the only way to do that is to follow the rules, of course, but also even mild symptoms, come forward, get tested. That makes a massive difference. In disability facility settings, as at the 27th of August, there are a total of 45 active cases. That's 31 staff and 14 residents. Aged care settings, there are now 1,362 current active cases, and I haven't got a total shift number for you, but as soon as I can update you with that, I will do so. Yesterday I committed just to provide just a quick update in relation to the Disability Response Centre. Again, I want to thank the Commonwealth Government, Minister Robert, the PM, for basically extending our disability arrangements to mirror what's going on in private aged care. I think that is a really important thing for us to have done. Both our governments have finalised the governance and leadership arrangements for that Victorian Disability Response Centre. That integrates both the State Control Centre and other senior people and senior functions from the Commonwealth Government as well. That's up and running as of today. Of course, ahead of those finalised arrangements, there's been Commonwealth and State senior officers that have been meeting daily to continue to manage new and existing outbreaks. Obviously, there are many, many people in these settings that are vulnerable, and we want to try and keep it out of those settings as much as we can. And using that really important collaborative, cooperative approach, that joint management, if you like, is really very important to that. We will continue to update you both in terms of numbers as they present in those settings and any other developments in the work of the Disability Response Centre. But again, thank you to the Commonwealth Government and its agencies for a very productive partnership on that front. Now, just before I ask Brett to speak to the epidemiology of the day, I just wanted to make a couple of comments in relation to the storm activity yesterday and into the evening. As you know, 3 people have tragically lost their lives in those storms overnight. A 4-year-old boy died after being struck by a tree in Blackburn South. He was taken to hospital with critical injuries, but sadly he died later last evening. A 59-year-old Tacoma man died after a tree fell on his car. Now, investigators have been told that a car was leaving a shopping centre car park when a tree fell and crushed the vehicle just after 6 p.m. last night, but those investigations obviously will be ongoing. Thirdly, a 36-year-old Parkdale woman has died after a tree fell on a vehicle in Fernshaw. It's believed the vehicle was travelling along the Maroondah Highway when it was hit by a falling tree at about 10 to 7 last night. The driver, she was a passenger, the driver is a 24-year-old Flinders man who was taken to hospital with, we believe, unbriefed minor injuries. Can I send on behalf of all Victorians our sincere condolences and best wishes to each of those families, and particularly the young gentleman who is still recovering from his injuries. This will be just a terrible time for them, and our hearts are with you, and any support that we can provide in what is a terribly difficult time, of course, we stand ready to do that. I just want to give a shout out to the SES. They are just amazing people. Whenever we need them, whenever we call upon them in sometimes the most extreme circumstances, they're always there. And I've been honoured and privileged both as a local member and in other roles I've had over my time in public life to meet many people in the State Emergency Service. They do just such an amazing job, and I want to thank each and every one of them for the work they've done overnight and indeed the work that they'll continue to do for many days. There have been about 2,000 calls for assistance since those strong winds began. 1,600 jobs or tasks have been completed, and the SES are working on the remaining calls as quickly as they possibly can. The majority of those calls, some 85%, are about felled trees, and about 10% relates to building damage. Mount Evelyn, Belgrave and Croydon have been the most affected suburbs. Now, I can confirm that there's about 56,000 households that have been affected by unplanned power outages. The majority of those are across the central region. It's expected that power will be restored, I'm told, by about midday, but there may be others where that doesn't occur until later on today. It may take longer. The final point I wanted to make in relation to the storms, this has been well publicised, but it's important just to remind people again, the Sylvan Dam water treatment plant did lose power last night. That power's been restored since, but it's very important that, and this is the advice of Yarra Valley Water, that there may be some undisinfected water in the system. So Yarra Valley Water's issued a precautionary boil water notice. That advisory is very, very important. We don't want people getting sick from potentially consuming water that hasn't been through that treatment plant properly. And of course we appreciate the media's help in getting those messages out. Now, just finally, we know that this is not an ordinary storm event because of course it occurs in the midst of very strict coronavirus rules. We have, I think, if not already, then we will very soon, so literally in the next hour or so, We will have detailed Q&As, detailed advice and guidance to anybody who needs to go and render emergency assistance, people who may need to act outside the rules for the purposes of supporting someone. That, of course, is not an invitation for people to do things that don't absolutely need to be done, but we do recognise that with the volume of work, and even though the SES do such an amazing job, there will be other arrangements, there'll be other needs that need to be met, perhaps by a family member. That advice, that guidance will be up on the website as soon as possible, and again, we'd be grateful if there's any way in which you can include some of that in your coverage. That would be, I think, of great benefit to those who've been affected. We know and understand this is unique, and we don't want those coronavirus rules to make it any harder, but we just have to find that balance point, and I'm confident that we can. So again, our sympathies to those who are grieving today because of this storm event, and of course our gratitude to every member of our emergency services, but particularly our State Emergency Service, who do such an amazing job. Whenever we call upon them, we're very grateful to each of them.